Good morning all of you. I am Dr. Swati Yadav, Assistant Professor Anatomy. Today I'll be discussing about an important topic, that is biliary apparatus. So starting with the slides of the biliary apparatus. Biliary apparatus includes the passages through which hepatic bile and gallbladder bile are conveyed into the second part of duodenum. So as we can see in the diagram, the apparatus is divided into two parts, intrahepatic and extrahepatic. The intrahepatic part, as you can see here, consists of bile canaliculi, canals of Herring, bile ductules, right and left hepatic ducts. Mainly we will be focusing today on the extrahepatic part. So the extrahepatic part consists of cystic duct, which you can very well appreciate here, cystic duct, common hepatic duct and common bile duct, and this structure which is known as gallbladder. Now starting with the cystic duct, just if you look at the diagram, the cystic duct drains the gallbladder into the common bile duct. It is between 3 to 4 centimeters long, and you can see that it is passing posteriorly to the left from the neck of the gallbladder. This is the neck of the gallbladder, and it is joining the common hepatic duct to form the common bile duct. If we talk about the relations, it is close to the neck of the gallbladder, as we have seen, and from before backwards these structures are cystic duct, artery and vein. These are also known as pedicles of the gallbladder. Behind you can see is the portal vein, medially is the common hepatic duct, above and laterally is the cystic artery. Another important triangle which is in relation to it is Callard's triangle, or the other name is cystohepatic triangle. It is nothing but a triangular space which is bounded inferior laterally by the cystic duct, superior laterally by the liver and medially by the common hepatic duct. So there is a triangular boundary form which you can very well appreciate in this diagram by the cystic duct, by the inferior surface of liver and medially by the common hepatic duct. So since we are saying it is a triangle, so there may be some structures in it. So what are the structures of this Callard's triangle? There are cystic arteries, one or two small cystic veins, cystic lymph nodes. There can be an accessory hepatic duct draining bile directly from liver to the gallbladder. This Callard's triangle is important because when we do cholecystectomy, the one method of operating and removing the gallbladder is through this Callard's triangle. We will see in the further slides. Now another important clinical aspect is here, sometimes the hepatic artery make a loop in front of the cystic duct. So the first picture is of the normal Callard's triangle. You can see the cystic artery with branch of hepatic artery and the content of which we have already seen about the Callard's triangle. Sometimes this hepatic artery makes a loop in front of the cystic duct. So this is known as Moynihan's hump. This is clinically very relevant because if a surgeon is operating, he or she should know that there can be an hepatic artery making a loop in front of the cystic duct. So when he or she is removing the gallbladder, it should be taken into consideration. Now coming to the hepatic duct is nothing but the confluence of right and left hepatic ducts. It is almost always occurs outside the liver. So it is arising from the confluence of ducts and by definition becomes the bile duct when it is joined by the cystic duct. It is 1.5 inches long and runs in the free margin of lesser omentum. If you talk about the bile duct is also known as common bile duct. It is about 8 centimeters long, and in the first part of its course it lies in the right free margin of the lesser omentum in front of the opening of the lesser sac, which you can very well appreciate in this diagram. In the second part of its course it is situated behind the first part of the duodenum, and its third part it lies in the groove on the posterior surface of the head of the pancreas, which you can see here. Here the bile duct comes into contact with the main pancreatic duct. Now this is the duodenum. So the bile duct ends below by piercing the medial wall of the second part of the duodenum, and it is usually joined by the main pancreatic duct, which you can see together here, Together they open into small ampulla in the duodenal wall called the hepatopancreatic ampulla, which you can see, or the ampulla of water. So bile duct and the pancreatic duct, they are opening in the duodenal wall through the ampulla of water. So there is also a muscle encircling which is known as sphincter of Fodde or the sphincter of hepatopancreatic ampulla. So there can be many abnormalities also. Sometimes they may come as a separate duct, sometimes they open above the papilla. This should be taken into consideration. So this is the whole picture which shows the biliary apparatus, the intrahepatic and the extrahepatic part, which we have seen. We are dealing with the extrahepatic part apparatus today, including the gallbladder, the cystic duct, the right and left hepatic duct seen beautifully in this diagram. The bile duct going into the piercing the pancreas, and you can see here that in the second part of the duodenum, in the major duodenal papilla, along with the main pancreatic duct, they are opening into it. Now we talk about the gallbladder. The gallbladder is a flask-shaped blind ending diverticulum attached to the common bile duct by the cystic duct. In life it is usually grey-blue in color and usually lies attached to the inferior surface of the right lobe of the liver. So this is the liver, this part of the liver is right lobe, and you can see on the inferior surface is the presence of gallbladder in a fossa for the gallbladder. And if we talk about in adults, that is between 7 to 10 centimeters long with a capacity of up to 50 ml, and it has a fundus. So gallbladder, if we talk about the parts of the gallbladder has fundus, it has a body and it has a neck, which you can see in this diagram. The neck lies at the medial end of close to the porta hepatis, where you can see it has always a short peritoneal cupboard attached to the liver, which is mesentery. And if you can see in this diagram that it's at its lateral end of the neck, it widens out to form the body of the gallbladder. And this widening is often referred to as Hartmann's pouch. It is nothing but the widening of the neck, and in some books you will find it's known as infundibulum of the gallbladder. The neck lies anterior to the second part of the duodenum. Another important clinical point is Murphy's point. It is nothing where it is in the relation to the surface anatomy. The fundus of the gallbladder lies behind the tip of the right ninth costal cartilage at the point of the intersection where the right linea seminolaris with the right costal margins are intersecting. So if it is important due to this because of the surface anatomy that the fundus lies at this level in the body. And if we talk about the blood supply of the gallbladder, the cystic artery we have already seen, which is a branch of right hepatic artery, is supplying the gallbladder. The lymph drains into the cystic lymph node situated near the neck of the gallbladder. And nerve supply, the sympathetic and parasympathetic vagal fibers form the celiac plexus. The gallbladder contracts in response to the hormone cholecystokinin, which is a very important hormone which everybody should know, and it is produced by the mucous membrane of the duodenum on the arrival of fatty food from the stomach. Now when we are talking about the gallbladder, the most important applied aspect is cholelithiasis. Cholelithiasis is nothing but formation of stones in the gallbladder. So what are gallstones? They are usually, the patient will not have any symptoms, they are asymptomatic. However, whenever they give rise to gallstone colic, they produce acute cholecystitis. So it can be acute or chronic cholecystitis, and to remember is we have to remember 4 F's. That means the gallstone colic or you can say acute cholecystitis is common in 4 F's: fatty, fertile, female or 40. So they are the more susceptible. If the stone is lodges in the cystic duct, the cholecystitis will be without jaundice, and if it is lodging in the common bile duct, the cholecystitis will be with jaundice. So you can see in this picture that the gallstone is impacted in the Hartmann's pouch. We have already talked about it. And what happens is whenever there is obstruction of the gallstone, there is edema of the gallbladder wall, the gallbladder distenses, you can see by the arrows. So since the intraluminal pressure increases. And this another picture showing a gallbladder with the stones lodged in it. What are the other implications of the gallstone? The gallstone may erode the duodenum also and lead to a cholecystoenteric fistula. So from the gallbladder, the gallstone can move to the duodenum, The gallstones can also produce adhesions with the transverse colon. Now, what is actually acute cholecystitis? So, what happens is it produces discomfort in the right upper quadrant or the epigastrium. The patient may come in the clinic with acute pain in the right upper quadrant of the epigastrium, and other symptoms which the patient can come with is the pain over the shoulder also. So, why is it? Because there is inflammation of the gallbladder may cause irritation of the subdiaphragmatic parietal peritoneum, which is supplied by the phrenic nerve. So this may give rise to referred pain over the shoulder because the skin in this area is supplied by the supraclavicular nerve C3 and C4. Now talking about the cholecystectomy. So if a patient is coming with acute cholecystitis and on the investigations you see the gallstone, so what is the next step? So removal of the gallbladder is cholecystectomy. So what are the preferable incisions? The incisions given are midline, upper paramedial or transrectus approach. So variations from the normal anatomy of the vessels as we have seen above to be kept in mind. And when we were talking about the Callet's triangle, we talk about the surgical approach is through the Callet's triangle or through the fundus of the gallbladder. So this is a picture showing how the surgical removal of gallbladder happens. So normally the Callet's triangle we have seen, this was the Callet's triangle. Now when we remove the gallbladder, you can see that we put double clips on the cystic ducts, so there is no drainage of the bile and the gallbladder has been removed. Another is that you clip the hepatoduodenal ligament, which is helping the gallbladder attach with the duodenum, and you remove the gallbladder. So that is all about the extrahepatic biliary apparatus. Thank you so much.